Billy Connie in the morning. Time for our Healthy Reno Healthy Beauty Tip of the Week.
That's right, Ed. We are joined by Matt Ladich. He is the Director of Government Programs, Hometown Health, Individual and Family Plans. That's what we're going to be discussing this morning. We're going to talk about some new programs and plans that have been released to the public. Hometown Health offering individual and family plans. Welcome to the show. Good morning to you, Matt.
Thank you for having us on. I appreciate it.
Well, who qualifies for these different plans?
Well, we're very excited. Hometown Health has never been in the individual market besides our Medicare products, and so this is a very exciting opportunity for us. Anybody that's uninsured now, anybody that hasn't retired yet or has retired and not eligible for Medicare or any government programs, anybody that's self-employed but doesn't have insurance through their employer, anybody working part-time that doesn't actually have access to benefits is eligible, as well as anyone working without health insurance is eligible for our program.
And obviously, because you're looking at people with different pay scales and different needs, are there different types of plans?
Yeah, we have actually 4 PPO plans, or preferred provider organization plans, where they have the ability to go in and out of network. And then we have 2 health savings account plans. Our 4 PPO plans are the most popular.
The health savings accounts, I've been hearing a lot about those. Can you talk a little bit more about a health savings plan? It seems to be more popular these days.
They're a lot more popular, especially for a lot of our business owners and those individuals that sort of have, unfortunately, accountants and tax advisors that can help them, advise them on how to set up those health savings accounts. But more popular in that they can defer part of their income to pay for their medical expenses during the year.
And this might be good for someone who doesn't necessarily have health problems. They can kind of put that money aside, and then if something were to come up, you kind of dip from that savings plan.
Yeah, because unfortunately, a lot of people, when they have an event or something happens, it's hard to come up with some of those cost-sharing amounts. With the health savings account, they have that set aside so that they have that money to pay for those deductibles and cost-sharing amounts.
Kind of like a rainy day fund.
Yes.
Well, I'm sure you're getting a lot of questions about the Affordable Care Act. Now, with the Affordable Care Act, am I required to buy a plan?
No. Again, with many of the government programs, it's a voluntary program. The Affordable Care Act will be in place actually in October. So October 1st, the state of Nevada Silver State Health Insurance Exchange will be advertising their exchange in the state of Nevada for an eligibility date of January 1st, 2014. You can sign up if you want to. There will be a number of different plans. They have what's called metal levels. So there'll be at least 4 to 5 different tiers of plans that they can choose from different premium amounts to different cost-sharing amounts. If you don't sign up and you don't have credible insurance, there might be a penalty, but that penalty won't happen for another year after. Mm-hmm. Again, everything's based on taxes. So again, it's voluntary. Some people actually make the decision that buying the insurance is more costly than actually having the tax penalty, but most people that need insurance are going to want to sign up immediately, especially if they have what's called a premium tax credit, where they'll get subsidies to buy their insurance going forward.
Interesting. And a lot of this information, too, is up on your guys' website. You can check out hometownhealth.com. If you want to find out more information about individual or family plans, you can also contact them by calling 982-3230. Again, 982-3230. And I did want to ask you one other thing. The Affordable Care Act, is this also helpful in the sense that this is making insurance companies more transparent? Is that what we want, so we know exactly what we're paying for?
Yeah, and one of the reasons why Hometown Health wanted to be in the market early. So the Affordable Care Act, again, for most individuals doesn't go into effect until January 1st. We wanted to be in early in February of this year to get our feet wet sort of in that market. What it does is, and what their hope is, it'll make it sort of like they call it a Travelocity sort of mechanism for people to go out there and be able to compare plans.
The gnome of healthcare. I like this. Okay.
Where it'll be much more transparent.
Right.
The only problem that we run into is there will be a number of different options for people to make. And so we sort of mining through that information to make sure that they make the best decision is going to be difficult.
Because there's a lot of misinformation out there.
And I like what you say, too, about the transparency, too.
Yep, they can talk to people at our organization. Our website is very helpful. And then the state of Nevada will also have what's called navigators and assisters that will help independently of insurance companies to get them assigned certain plans.
Well, you can find out more information. Log on to hometownhealth.com. Thank you so much, Matt Ladich, Director of Government Programs for Hometown Health. This has been your Healthy Reno Health and Beauty Tip of the Week.